For most kids, blowing out a birthday candle is pure fun. But for children with epilepsy, even a flashing light can trigger a seizure. And while medical risks are hard enough, what really lingers is the fear of exclusion, the feeling of braving a complex, underinformed condition alone.
In the United States, countless families struggle to navigate a healthcare system that fails to prioritize epilepsy care. For example, a family in rural Kentucky faced significant hurdles in obtaining a diagnosis for the child and continues to struggle even afterwards with insurance and high medication costs. Admittedly, this story is not unique. A report by the Epilepsy Foundation reveals that nearly 30% of individuals with epilepsy in the U.S. encounter significant barriers to accessing adequate treatment.
Globally, this negligence is even more pervasive. In China alone, despite affecting over 9 million people, more than 75% of the population is unaware of what epilepsy is or how it can be managed. Seizures are often seen as signs of mental instability, weakness, or even a family curse, leaving children isolated, families ashamed, and critical medical care delayed.
Inspired by first-hand struggles of one of our founders, EpiKids Support Alliance aims to break these barriers.
Hi, my name is Sherry Fay, and I'm from Washington State.
And I'm Phoebe Ning from Beijing, China. We're the co-founders and chief directors of the nonprofit EpiKids Support Alliance. Working with a global team of permanent and temporary volunteers, our approach to improving the lives of children with epilepsy is defined by a three-pillar approach.
Our first pillar, education, provides families with accessible multilingual resources that explain epilepsy in clear, relatable terms. Our easy-to-navigate platform contains a host of publications covering topics like nutrition to first aid in emergency situations. On our social platforms, users can find public interviews with a wide variety of individuals affected by epilepsy, from activists that advocate for awareness to others who have yet to find the strength to share about their condition publicly, yet still choose to tell their stories with us anonymously. In regions like China, where misinformation is widespread, these resources help dispel myths and guide families towards proper care.
Secondly, we collaborate with educators, healthcare professionals, and policymakers to promote better support systems for children with epilepsy. In Washington State, for instance, we've worked with TVW, the Public Affairs Network, to share real stories and push for policy changes to improve educational access and social inclusion.
The third pillar, community support, focuses on reducing isolation. Through virtual support groups and in-person events like concerts and exhibitions, we connect children and families, fostering dignity and belonging. This past November, as part of our Epilepsy Awareness Month campaign, we successfully hosted a large-scale art exhibition event at the Keystone Academy in Beijing, China. Centered around the theme Empowered Rising, the exhibition celebrated identity, triumph over adversity, and an overcoming of barriers related to epilepsy.
EpiKids Support Alliance operates with minimal costs, relying on volunteer experts and translators to create multilingual resources without paid content or development services. Revenue comes from a diversified financial model that includes donations, grants, and partnerships with medical and educational organizations. These funds are reinvested into cost-effective scaling strategies, such as online resource dissemination, platform improvements, and outreach initiatives. Additionally, we allocate a portion of our funding to support epilepsy-related research and contribute to organizations like the Epilepsy Foundation.
In the next 6 months, EpiKids Support Alliance plans to launch #EpilepsyUnfiltered, a global initiative combining youth leadership, social media, and educational outreach. Our goal is to empower at least 50 student epilepsy ambassadors across 5+ countries to share personal experiences, cultivating understanding through social media campaigns and interactive events. By November 2025, we aim to engage at least 25 schools worldwide in International Epilepsy Education Month, organizing activities such as classroom workshops, live Q&As with medical professionals, and social media challenges that reach at least 6,000 individuals. We will measure impact by tracking participant engagement, content reach, and feedback surveys to ensure meaningful awareness and advocacy.
Ultimately, what sets EpiKids Support Alliance apart is our focus on storytelling as a tool for empowerment and our commitment to creating a truly global support network. This focus on lived experiences resonate across borders and languages. With more, epilepsy is not a condition that exists in isolation.
Each of us is a stakeholder. Whether we live with epilepsy, support someone who does, or happen to witness a seizure in a public space. The need for awareness and empathy extends to classrooms, workplaces, and communities worldwide. This universal relevance gives EpiKids an immense potential to create lasting change, proving that while epilepsy is a medical diagnosis, isolation doesn't have to be part of the experience.